Good morning and thank you for joining us. I'd like to start off with a brief case update. We are still at 50 positive cases, so no new cases to announce today. We have around 3,468 tests that have come from Lane County to our various local labs. Of our confirmed cases, we have nobody currently in the hospital, 31 individuals recovered now, and 17 people that were waiting on recovering. Who are doing so at home, still holding at 2 individuals who have passed. We'd like to let you know about a change in our press briefing schedule. So starting next week on Tuesdays and Thursdays, we'll have the press release or the press briefing at the typical time. It'll be at 10:30s. Tuesdays and Thursdays, we're not going to be doing them on Monday, Wednesdays, and Fridays. We will continue by having an opportunity for our elected officials to speak once a week. And that's going to be happening on Thursdays. And then we're going to try to make as much information available to you on those 2 days, but not really flood it with a everyday press briefing. So that's starting next week. We are also starting Spanish-speaking press briefings, so those will be live cast on Central Latino Americano's Facebook page starting today. And we will have those every Thursday following this press briefing. But they will be coming from Central Latino Americano staff and broadcast on their page. If you or someone you know is a Spanish speaker and in need of Spanish speaking resources, that's a great opportunity to tune in and get the latest updates. I'd like to go over just some updates on our Lane County blueprint for reopening. This is something that we've been working on in advance of looking at how and when potentially Lane County can approach that topic of reopening. And really, I think, there's been some plans floated out there. You see from a few counties across Oregon, Baker County, Jackson County, a few others. And what you'll notice about their plans is they really are business focused, and they dive down into detail regarding how their businesses will reopen and to what capacity. Our plan's a little bit different. So our plan really focuses in on what we know about our situation, public health wise, and really establishing some thresholds and some numerical values for when we believe we are in a situation, according to Dr. Ludke's 7 criteria for reopening, when we're in a situation where we can confidently go forward. So our process to that is we will let our board know about where we're at, Board of County Commissioners, and keep in good communication with them. And then ultimately that will be a process by which they make a recommendation to the governor's office, and it will be ultimately up to them. So far what we are looking at right now, if you've been tracking with us, you know that we haven't reported any new cases for a number of days. We are still in the yellow in terms of our plateau. And that is looking, at our epi curve. So that's not necessarily looking at day by day whether there's a case or not a case. It's looking at the entire trajectory of the disease. And so while we are in a really great place, we believe, based on what we know about the disease and what we're able to ascertain about testing or through testing, we are still very much in that plateau and in the yellow. So not seeing the green there just yet. In terms of testing available locally, Dr. Ludke set a benchmark of 500 tests being performed here locally daily. Right now we're at about 149 tests happening in Lane County per day on average. So that's one thing that we would like to improve. And the way that we improve that is by people with mild symptoms approaching your provider, your medical provider, about getting tested. We have been communicating with our local provider community about the fact that the guidelines have changed, and now people who have mild symptoms should be considered for testing. So if you are experiencing those classic COVID mild symptoms like a dry cough, a mild fever, etc., then please do approach your provider about getting tested, and that is available here locally. So as we start to see those testing numbers go up, then we'll be closer to our benchmark of meeting that 500 tests per day. Finally, we're also looking at our overall FTE needed for contact tracing and are actively pursuing that. We have our ICU beds and ventilators. You'll see that is currently in the green. And then our PPE down here. So one little note about the PPE, when this plan becomes available, you will notice that our PPE numbers are not static. So we have a clearinghouse here at Lane County that has served as a sort of stockpile for our community. Currently, what we're doing is keeping some of that stockpile obviously on hand for a second wave, but also distributing some of the PPE that we've received back out into the community. You know, our dentists and various doctors' offices across the county who were not able to see patients during the outbreak were so kind and generous to donate much of their PPE to the county and to the overall effort. And we are now redistributing that PPE back into those settings so that when the restrictions are relaxed, those facilities will have adequate supplies. So as we receive more PPE from the state and from other localities, we will continue to replenish our stockpile and continue to make that available within our community. Finally, we are looking at number 6 and number 7, our blueprint on the process of restriction relaxation and our OHA support for restriction relaxation. And again, those are two pieces that we will look to the state and their support on, and then also our Board of County Commissioners who will ultimately be part of that driving force from their position. Finally, you know, as we approach this topic of reopening, and that I'm sure that's top of mind for many people, we need to, as a community, really take to heart what's behind the messages that we've been putting out there every day. Certainly, we believe that the governor's stay home, stay live order came at the right time and really helped prevent a lot of cases here in Oregon and certainly in Lane County. However, regardless of whether there is a stay-at-home order in place or not, if there are restrictions in place or not, there are things that we would love to see our entire community really take to heart and continue regardless of what restrictions are here. One of those continues to be staying at home if at all possible. So as you start to see the recommendations change and there's more freedom to move about, please do keep in mind the fact that if we limit our travel and we limit how much time we spend outside of our home, then we limit the opportunities for the disease to spread. Physical distancing, it will still be important even after we see our businesses open up. And certainly we will be working with our business community and the state will be providing guidance on how those businesses can remain or stay open with physical distancing. But, you know, as on an individual level, it's incredibly important that you keep that in mind, that you understand that if you do decide to visit with friends, physical distancing will still be a good strategy to help prevent any unnecessary spread. Still wear a mask in public if you're not able to socially distance. So there are many situations where you're out and about where a mask might not necessarily protect you or someone else, but if you're in a situation where you're going to be in close proximity to people and you can't maintain that 6 feet of distance, by wearing a mask you really do help prevent the spread by sort of blocking that spray that comes out of your mouth. Also, washing your hands like it's the new normal. So, you know, obviously this is a topic that public health talks about every year when it's flu season and throughout the year, really. And I think we have some more people washing their hands more frequently than ever before, which is great news. But we need to continue that this piece about washing your hands throughout the day with warm soap and water, using hand sanitizer when that's not available, is really something that we should do just going forward as a common practice. Cover your cough and sneeze and dispose of the tissue that you coughed or sneezed into. That is another thing that you've heard us say year in and year out, but something that we've seen more compliance on and more people doing than ever before, and something that as we move through these restriction relaxation processes, that we understand that will be incredibly important as well. And then finally, if we can continue to keep our gatherings to a minimum. Obviously, as things start to open up, people have only been having contact online or through phone, and you'll be eager to have those social opportunities, but please do keep in mind that the smaller the gatherings, the better. That really, if we can have those kind of touch points where you can reacquaint without having a large party, that will help everyone. And then finally, before we take any questions from members of the media, I would like to just once again thank our ASL interpreters. They're coming from All Hands Interpreting. Very often you've seen LaDonna Steiner. Today we have Charity Horn, who is one of the from All Hands Interpreting as well, and they've just been a fantastic resource. And quite honestly, I admire their ability to take my sometimes rambling words and interpret them so quickly and with such ease and grace. So thank you for their services. And at this time, I'll take any questions from members of the media.
Brian Anderson with KEZI. Now that we're at a week off with no new cases, will Lane County be joining other counties and asking the governor to allow us to start reopening?
So the question comes from Brian Anderson at KZI, and he wants to know, now that we're a week out with no cases, will Lane County join with other counties in asking the governor to relax restrictions? So Brian, the governor has outlined a process by which this can happen, and really what it looks to is the local public health agencies evaluating their situation and then making recommendations to their Board of County Commissioners and their leaders, and then that conversation will happen with the state, and then we will see whether or not the state approves and what the considerations are. So I think that there's a lot left to be known on that front. What I can tell you is that in terms of preparing for that with the public health aspect, really looking at that data and those numbers, that's something that we're ahead of the game on, and that we've been working very hard to make sure that we have an accurate assessment about where we are right now in our preparations, not only for this outbreak, but in preparing for a second wave. So hopefully that provides some insight. And that's all we have for today. Thank you for joining us.